COVID-19, previously called the 2019 novel coronavirus, is now present in over 60 countries, with more than 88,000 confirmed cases. Tobago has had one suspected case, a citizen who studied in China. That national has been screened, quarantined, tested, and cleared of having the illness by health officials. Like the airport and seaport, our health centers and hospital also have procedures to treat with potential coronavirus cases.
The key thing in terms of response to primary care is identifying signs and symptoms, identifying a positive travel history or contact with persons who have that travel history. Once we have that, we will then isolate the person within the compound. We will notify the hospital that the person will be coming. We will notify the transportation vehicle, in this case it will be Thames, all right, as to pick up where they're picking up and for transport to the hospital setting from there.
The patient will be given either a surgical mask or an N95 mask, depending on the severity of their condition. Other forms of treatment will be provided as needed. Protective measures will also be enforced in transit to the Scarborough General Hospital.
Our ambulance services have the 2 compartments where we can separate our drivers and the attendants. All right, we could also have the person in the back, depending on the severity of the illness. That person will be in full and appropriate PPEs. The driver would also be in the appropriate PPEs moving so that we ensure we safeguard persons.
Medical practitioners at the Scarborough General Hospital are already updated on procedures to treat with potential coronavirus cases. Head of the Accident and Emergency Department, Dr. Ian Sami, explains.
It wasn't as if we were starting from scratch. COVID-19, being a respiratory infection caused by a virus, was very similar in many ways to the influenza threat that we had in November and December. And based on the WHO and PAHO guidelines, we were able to adjust those plans to take into consideration some of the special differences in this virus. We again revisited our plans, and we actually had a walkthrough of our department to make sure that we had the resources needed and sensitized our staff on what their roles were in case anything needed to happen.
Sensitization meetings are ongoing with medical staff as well as various stakeholders. Health officials are also updating the public through the media and via social media. Persons are advised to protect themselves by following these guidelines. Wash your hands frequently with soap and water for at least 20 seconds. Use alcohol-based hand sanitizers if soap and water are not available. Avoid touching your face with unwashed hands. Disinfect frequently used surfaces. Practice social distancing. And stay at home if you're sick. I'm Omodara Mills for Let's Talk Tobago.